In a sweeping change that will affect millions of Americans, the newly approved Medicaid Overhaul is bringing major shifts that could leave many seniors without the coverage they depend on. If you're one of the millions who rely on Medicaid for healthcare, this is a crucial moment to pay attention. The government has rolled out new regulations, and without immediate action, your access to essential health services could be at risk. This isn't just another policy update. It's a major shift that could change how and when you receive the care you need. The new rules have been designed to streamline the Medicaid system, but they also come with serious risks. Millions of seniors, veterans, and low-income Americans who currently rely on Medicaid for medical coverage may find themselves cut off if they don't meet the new requirements. These changes could affect your eligibility, your access to prescription medications, and even your access to routine healthcare appointments. It's not just about bureaucratic red tape. This is about your health and well-being. If you don't take immediate steps to ensure you're still eligible under the new rules, you could find yourself without coverage at a time when you need it most. That could mean longer wait times for critical treatments, loss of access to life-saving prescriptions, and possibly even delays in emergency care. But there's hope. By understanding the new regulations and acting quickly, you can make sure you're not caught in the crossfire of this overhaul. In this video, we'll break down exactly what's changing, who's affected, and most importantly, how you can take action to safeguard your coverage. Don't wait until it's too late. Your health and security depend on staying informed and proactive in these uncertain times. Stay tuned, and we'll walk you through everything you need to know to avoid losing your vital Medicaid coverage. The overhaul of Medicaid has sent ripples across the healthcare system, affecting not only millions of Americans but specifically seniors who rely on the program for their medical needs. This isn't just a minor tweak in the system. It's a fundamental change that could potentially impact access to care, medications, and treatments for some of the most vulnerable members of our society. So what exactly is changing, and how can you ensure that you won't lose your coverage? One of the most significant changes in this Medicaid overhaul is the tightening of eligibility criteria. In the past, many individuals who might not have qualified for Medicaid could still receive benefits under certain conditions, such as emergency care needs or low-income status. However, the new rules aim to enforce stricter eligibility requirements, meaning that certain individuals may no longer qualify for Medicaid. If you haven't updated your information with Medicaid recently or confirmed your eligibility, it could lead to unintended gaps in coverage. For those who are in the process of renewing their coverage, this overhaul means that it's essential to stay on top of the process. Under the new rules, many recipients are being asked to re-verify their income and assets. Some individuals who used to qualify under prior income thresholds may find themselves no longer eligible. This is especially concerning for seniors who might not be aware of the changes or who don't know how to navigate the complex process of updating their information. One of the most immediate impacts of this overhaul is that many seniors who have been receiving Medicaid coverage through expanded programs might face a loss of benefits. If you've been on Medicaid for some time, you may be familiar with the continuous coverage policy, which was put into place during the pandemic to ensure that individuals would not lose their health coverage despite lapses in documentation or renewal. Well, with the end of the public health emergency, continuous coverage is now being phased out, and many people will have to reapply and prove their eligibility once again. This shift could leave a significant number of seniors without coverage if they miss key deadlines or fail to submit the necessary documentation. While Medicaid is a federal program, each state administers its own Medicaid program, which means that the specific changes you face could vary depending on where you live. Some states are implementing more aggressive eligibility checks, while others are offering more flexibility. For example, some states might provide extended periods for beneficiaries to submit their documentation, while others may have much stricter timeframes. It's essential to know how these changes apply to your state and what steps you need to take to ensure you remain covered. For seniors, this situation can feel particularly overwhelming. Navigating the bureaucratic maze of eligibility checks, paperwork, and deadlines can be confusing and stressful, especially when it comes to something as vital as healthcare. But here's where the good news comes in. There are steps you can take to make sure you don't lose your Medicaid coverage. First and foremost, it's crucial to stay informed. Many seniors are unaware that the rules are changing, and as a result, they may miss important deadlines or fail to submit the necessary documentation. Check with your state's Medicaid office to find out exactly what you need to do to reapply or renew your coverage. Don't wait until the last minute. Start the process early so that you have plenty of time to gather any required information. Some states have already started sending out renewal notices, so keep an eye out for mailings or emails from your Medicaid provider. Next, make sure you understand the changes to eligibility and how they apply to you. If your income has changed in the past year, or if your living situation has shifted, you may need to provide updated documentation. This could include tax returns, proof of income, bank statements, or other financial records. Understanding what you need to provide and getting those documents together early will help you avoid delays. If you're unsure about any of the new rules or how they apply to you, it's a good idea to seek help from a professional. Many local organizations, including senior advocacy groups, can assist with Medicaid renewals and eligibility questions. In some areas, you can even find free legal assistance if you're having trouble navigating the paperwork or understanding your rights. These resources can be invaluable in ensuring that you don't fall through the cracks during this overhaul. But it's not just about staying informed and submitting paperwork. It's also about knowing your rights as a Medicaid recipient. The changes to Medicaid have sparked concerns among many seniors about the potential for unfair denials or confusion surrounding the renewal process. If you find that you're suddenly ineligible for Medicaid, or if your coverage is interrupted, you have the right to appeal. Every state has an appeal process for Medicaid denials, and if you feel that you were wrongfully cut off from coverage, you should use this process to contest the decision. Along with staying on top of your Medicaid renewal, it's essential to explore other options in case you do lose coverage. If you no longer qualify for Medicaid under the new guidelines, there may still be other programs that can help you. Some seniors may be eligible for the Medicare Savings Program, which can help pay for premiums, copayments, and deductibles. Others may find that they are eligible for assistance through other state or local programs designed to help low-income seniors with healthcare costs. It's also worth considering private health insurance options, such as short-term plans or supplemental insurance, if you find yourself without Medicaid. While these options may not cover all the same services as Medicaid, they can provide a temporary safety net while you explore longer-term solutions. Some insurance companies even offer specialized plans for seniors, so it's worth reaching out to providers to explore your options. In some cases, seniors who lose Medicaid coverage may become eligible for other public assistance programs, such as food assistance or housing support. Don't hesitate to look into these programs and apply for assistance where you qualify. Many people don't realize that these programs exist and can be a lifeline during times of uncertainty. There's no question that the Medicaid overhaul is a huge shift, and the changes will undoubtedly cause some confusion and disruption. But it's also a reminder of the importance of staying proactive when it comes to your health and well-being. Don't wait until it's too late to find out what's happening with your coverage. Take action now to ensure that you won't be caught off guard by the changes. If you've been receiving Medicaid for years, it can be easy to assume that nothing will change, but with this overhaul, the landscape is shifting. By staying informed, keeping track of deadlines, and seeking help when needed, you can protect your access to healthcare and avoid the pitfalls that so many others may fall into. So, what's the next step? If you're unsure about your current coverage or how the Medicaid changes affect you, start by contacting your Medicaid provider or state Medicaid office today. Ask for clarification on any changes and find out what actions you need to take to ensure that your coverage is renewed without a hitch. Make sure to gather all necessary documents and take advantage of any resources available to help guide you through the process. Remember, the clock is ticking. The Medicaid overhaul is already underway, and millions of seniors are facing uncertainty about their health care. Don't let yourself become one of them. Be proactive, stay informed, and take the steps necessary to secure your coverage. Your health and your future depend on it. In conclusion, while the changes to Medicaid may seem daunting, they're not insurmountable. With the right information, guidance, and action, you can protect your healthcare coverage and ensure that you're not left behind. Stay informed, update your documents, and seek help if you need it. Don't wait. Take control of your healthcare today to avoid losing access to the benefits that are rightfully yours.